Okay, I see Dr. Ozioma. Okay, welcome to the show. Welcome to the show. I assume based on your title, you're a medical professional.
Yes, I'm a pharmacist actually.
This is perfect. What do you think about this drug?
This drug has been on the market. It's just that now it's been approved for a higher dose in weight loss. But this medication is actually Ozempic, and it's a diabetes medication.
I know there's a lot of pharmaceutical companies, they like to repurpose drugs.
If there's a side effect for a medication and they can market that side effect and it's safe, they will repurpose it.
So that's probably part of the reason why one of the good side effects for people using it as a weight loss drug was improvement with blood sugar and things of this nature, since the original purpose of the drug was to help with that.
Yes, but it's at a way lower dose. So the dose that they're giving for weight loss, I believe is 2.4. That they give for diabetes is 0.5. They have two different doses, but the dose is substantially higher. I think that in terms of weight loss goals and all the other medications on the market or that has been on the market for it, this drug seems to be the safest. Patients have been on this drug for years, so it's proven to be safe. The only thing different is the dose, but it's not going to affect the heart like the other amphetamine type drugs did.
Yeah, that's a very good point, because there's usually some side effect with a jitchiness or some kind of heart problem, like you said, because it was a stimulant.
Exactly. Like you said earlier, we have this hormone in our body, and typically with medications, we try to replicate what our body already has and then give it, like insulin. Where our body uses insulin, they give us insulin.
So Dr. Ozioma, the name Odili, where's that? I've not seen that in a show.
It's a Nigerian name.
What was the show with the guy? And he's an African actor. I think he played a character called Odili. So I know I've heard that name in a show before.
Someone asked in the chat if, is the reason why they stopped is because their appetite was suppressed for so long. It's not a matter of how long it was suppressed. It's just, is it going to be suppressed anymore? So unless they train their mind to eat smaller portions, then, it'll continue. But if they were just, not eating because of the medication and then their appetite back, you have to use it with your cognitive as well. Train your mind, okay, this is how much I'm going to eat. So when you're off of it, you're still used to eating that small portion.
That's a great point. Great point. They didn't say it explicitly, but at least the stuff I read is that they had not done that. So as soon as they removed the Band-Aid, this being the drug, immediately they went back to what they were doing before. The appetite immediately came back quickly, and they went back to their bad habits. So the weight came back on. If you're not making that lifestyle change, as you pointed out, cognitively, if you're not making that change, then yeah, you're going to run back into problems. Right?
The only issue would be having access to it. With medications this high, insurance companies typically want you to try other means before they pay for that. So it depends on how good their insurance plan is.
Okay.
Because this medication, like you said, is going to be about $2,000.
Yes.
There are coupons, manufacturer coupons. So if you go on the manufacturer's website, you can apply.
Yeah, I think that's something called a savings card, which if you qualified was like $25 per month for up to 6 months.
Sometimes with some medications, sometimes after 6 months, you can reapply. I don't know how this medication is doing it, but for other manufacturers, they do allow you to reapply after 6 months. Yeah, only certain medications. So I can't speak on Wegovy, but some manufacturers do allow that.
First, I want to make sure that you're aware it's Adebisi from that show that you were speaking about. I loved that show.
Yes, thank you.
This drug is ridiculously expensive. I'm wondering who can actually afford this medication in the Black community? Who's going to be able to afford this? There's so many racial and socioeconomic disparities that are existing in the world. So if we think about the people who have this medication or who have access to it, it's really going to be the top tier percentage, I would say, of the community.
It was hard for me to find information to answer that question because I was doing all sorts of Google searches, and it was difficult to find what it would cost with insurance and what's the likelihood of it. All I could find was that, I don't know, it was 40%, 50%, something like that. Because it's a new drug and it's hard to get prescriptions for such drugs, basically, which would then limit it to wealthier people because, that's more than a mortgage, right?
Exactly. And many insurance companies, I'm sure, are not covering it due to it being so new. No one probably has a generic yet. So there's not a less pricier alternative for people to be prescribed.
You made a really good point. One thing insurance companies look at in the long term is if I don't help my customer or my patient lose weight weight now, I could potentially be paying $30,000-$40,000 to fix their heart attack. You know, they believe that an ounce of prevention is worth a pound of cure.
Yes.
So most likely they will pay for it, but you would have to show, kind of like weight loss surgery. Most insurances don't pay weight loss surgery out the rip. You have to show that you've tried to lose weight for 6 months, that you've went to a nutritionist, et cetera, et cetera, et cetera. So it may not be the first thing they pay for, but in the end, it will save them more money if they get the person to lose weight, because then they won't be paying other diabetes. You know, diabetes medications are expensive. They can range from $1,000 to $5,000 a month versus just paying this for a year, and then now it prevents them from having diabetes, it prevents them from having high blood pressure, it prevents them from having high cholesterol. But yeah, if a person doesn't have insurance, it's going to be hard. I've had patients come and get their medication that they needed, and they see the price and they tell me, I'd rather die than pay for this.
My goodness, that's insane. Affordability and access to the medication, to me, are the hugest drawbacks of this drug. But hopefully in the future, it can be something that can be accessible to more people in the community who are severely overweight or morbidly obese. They tend to be people of a different, I would say, skin color.
Yes.
Obviously, if something like this can be available, it would be awesome.
We Black people make up, unfortunately, the largest part of the obese population. I know I was in it myself, right? And yeah, there's so many things, the food deserts, things from our culture with the foods we had coming back from slavery. List goes on and on and on. Hopefully, Dr. O is right in a sense that, like, for example, I have sleep apnea. So I got the CPAP machine, used it, and then because I didn't like it, it didn't work so great, then they would then authorize something more expensive. Let us use this oral appliance. Typically what happens with new drugs, because the only thing I saw was that there will not be any generic for a very long time with any new drug.
New drugs, once they come out, they have a patent. A patent states that no other company can produce this drug for a certain amount of time. Now, once the patent ends, they have competition. So there's going to be a generic out. And then at that point, sometimes the company that owns the drug will also create a generic for it. So, and then they keep the price high. So it may drop from $2,000 a month to $1,000 a month, unless another company wants to make it $500 and they have someone to compete with. But as of now, they're the only person that can supply it, and they try to recoup all the cost that they spent researching the drug. So it's going to be a while. It's going to be at least 7-8 years before a generic comes.
In our community, so a lot of people don't have insurance. From what you've seen, if somebody goes to, say, the Affordable Care Act, because I don't know the answer to this, is that insurance good enough to get access to a drug like this?
Typically not, just because they can exercise. So they're looking at, like, you can exercise versus a person who has diabetes. You know, yes, they can exercise, but if they don't have medication, they can pass, you know, within an immediate year. So yeah, typically not. This drug will be considered more of a luxury.
Okay, like surgery in a sense. Okay. So if you don't have a really good job and or with a really good company, then your insurance is probably not good enough to get you said drug. So this is not one of those cases where people are going to be going to Mexico for that drug. Because I guess they're going for generics in that case, or is it just a cheaper version of the same drugs that would be sold in another country?
If someone went to Mexico for it, it would be created in an under the table fashion, right? It would be another company that's not authorized to make this drug. They're making it.
Okay.
Yeah. Now the
no
thing is,
FDA approval, basically.
Right. Like I said, this drug has been around, and there's other drugs in this drug class. It just hasn't been approved for weight loss. So when they say it hasn't been approved for weight loss, it's not that it won't work for weight loss, it's that they haven't studied it. This drug has been shown to cause thyroid tumors in rodents in a dose-dependent fashion, meaning that the higher dose that they got, the more likely that the rodent would get thyroid cell tumors. Since this weight loss drug is about 400% higher of a dose than the diabetes medication, that means that they're 400% more at risk for that side effect. And when drugs come out, you really don't know what's going to happen in 5 years to the people who took it until you wait 5 years. If a person did want to take this medication, they
Mhm.
should lose weight as fast as they can and get off of it.
Got
So
it.
it's highly unlikely. That means that it's only a 1% chance that it could happen, not that it doesn't happen.
Of course, if you're in that 1%, then that's a problem, right? Yeah.
Yeah, so I mean, it's just a risk. You have to choose your poison. Do you want to die from obesity, or do you want to have a 99% chance that you won't get sick from this drug and drop 35 pounds?
That's a great point.
It's back to the pick your poison type thing. I think what you said is the best thing. You use this thing as little as possible and then you move on. Which is what
Exactly.
medication is supposed to be. Unfortunately, we live in where people get on meds and they stay on them. The analogy I tell people, if you had a kid coming to you with a cut and you kept putting a Band-Aid on, eventually you should stop and figure out what is cutting the kid. It's not just keep putting a Band-Aid on, right? Like not stitching it up. You should like, how are they cutting themselves? But we tend to just keep taking another pill or another injection and so on and so forth. It's unfortunate, but yeah, when you get in a bad state physically, there is going to be some issues. You know, I remember when my skin was a mess, getting a haircut was embarrassing and my scalp would just flake like crazy, right? And of course, now I get a haircut, it doesn't flake, but you know, I'm not obese anymore.
You know, what I predict with this medication, knowing the pharmaceutical industry, is that people are going to be on it way longer than 2 years. You know, take high blood pressure medication, for example. If a person is overweight and they're diagnosed with high blood pressure, they can take the medication while they're losing weight and get off of it.
Right.
Some patients do get off of it, but the lifestyle, or, you know, the way it is that you just take it forever. I've seen patients lose weight and say, hey, I don't need my diabetes medication anymore.
Yeah.
But it's very rare. So it ends up being a maintenance drug. So hopefully this medication does not become a maintenance drug, but, you know, you get money when people are going to see their doctors every month. You get money when people are coming into the pharmacy every month. Being healthy is going to deplete their pockets.
Because you are determined to transform your body, you made it to the end of this video. To get more tips about how to look great and feel even better, check out one of these videos you see on the screen. I'm sure you'll enjoy them. So later's my massive. Me I go long now. For those who don't speak Jamaican patois, that's goodbye, my people.